guys, it's Artasia Olivia. Welcome back to my channel. I hope you guys are doing amazing. Today's video, we are talking about the best types of Psych RN jobs for PMHNP students. And we are discussing Psych Sub-Specialties. So if this is something that interests you, stay tuned. If you don't know who I am, my name is Artasia Olivia. I am a Psych NP student and I'm almost done with my Psych NP program. I finished at the end of February and I graduate in May. So I'm super excited. So I wanted to come to you guys today because a lot of people, including me, always tell nurses to get psych experience if you want to be a Psych NP. And I know y'all like, get experience, like where? What kind of experience? Like why? So I already made a video about why you should get psych experience before you become a PMHNP. Check that out. So this video is really talking about how to get that psych experience and like where to go, like what are the best places to get that experience. So I have 6 different jobs and we're just gonna hop right into it. So the number 1 job that you want to have to get some good psych experience before you become a Psych NP is adult crisis stabilization. So if y'all don't do nothing else, please take away this job right here. Adult crisis stabilization is pretty much dealing with acute psychiatric patients. And this is, you can find places like your ER, they do acute crisis, and then like even like actual like stabilization centers, they do acute crisis. And this is pretty much when your patient is like in an immediate psychiatric emergency, like they're unstable, so like suicidal ideation with a plan, 1013s or Baker acted, which pretty much means involuntary holds, psychotic patients that are in deep psychosis. You'll see all different types. Patients that suffer from substance abuse and they are going through severe withdrawals. So yeah, it's like pretty much psychiatric emergencies and mental health emergencies. And this is like usually inpatient. They keep you there for a couple days to like a week or 2 weeks or so. And they hold patients there just to stabilize them. And this is one of the jobs that I have worked at before, and I have another video going over 4 psych jobs that I've actually worked at. And when I tell you, I learned so much information there. So in this type of job, you will do like a lot of admissions, and I feel like a lot of the admission, like when you admit the patient, it gives you a lot of like assessment. It builds your assessment skills. And for Psych NPs, that is very important to be able to assess a psychiatric patient very well so you can diagnose them properly and ultimately give them the proper treatment to help their condition. So if you want to like build up your assessment skills and know what to do in a psychiatric crisis, this is the perfect job for you. This type of job have like the worst of the worst patients, the sickest of the sick, just very, very like acute psychotic patients. And sometimes like if you're scared of psych, or you know, if you're nervous of going into it, if you're able to work here, you can work in any psych job, I'm telling you. So number 2, the next type of psychiatric job or experience that I highly recommend is adult long-term care. So after the patients are stabilized, like at a acute crisis center, like the one mentioned in number 1, once they like calm down, they're stabilized, they're usually sent off to like either their family, or if they still need some more help, they'll be sent off to facilities such as this one. And so this center, these type of jobs like you're with them for long periods of time, like months, years. You're pretty much like helping them maintain stability, and like these are patients with chronic conditions. So you really learn how to take care of a psychiatric patient over time. So a lot of medication management, a lot of therapeutic communication. You learn how to, facilitate group therapy sessions. You learn how to redirect patients when they are, like not as stable, I should say. So this is a really, really good job. They're not as sick as the acute crisis stabilization center, but they are, chronically ill. So this is another job that I listed in that video that I mentioned before. Actually, the first 4 jobs are the ones that I listed in my last video. And I currently work at a job like this. We get the worst of the worst in the area. I work at like a state hospital, that do this type of care. And so a lot of the patients that don't get accepted to like other private like centers like this, long-term centers, they come to us. And so you still get pretty rough patients, but I mean, they're not as like acutely psychiatric sick, if that makes sense. So number 3, I highly recommend child crisis or long-term centers. So this is pretty much number 1 and number 2, but just for children. Usually they have more like long-term child facilities. They may have acute child facilities, but it's usually like integrated with like the adult ones. I never seen a child acute center by itself. But either way, if you can't get to the adults, working with children with psychiatric conditions is a good third option. I highly recommend you working with the adults. Like if you can go to the first or second job that I mentioned, but you'll get really good practice and experience here, especially like if you know you want to go into child psych as a PMHNP. I highly recommend this area if you know you only want to work with children, but I recommend trying the adults first because you actually learn how to take care of a psychiatric patient that way. With children, it's a little bit different. It's a lot of different moving parts and varying factors, such as like calling patients, smaller doses. So it's not as like broad as working with adults, but if you can't get an adult job, this is another really good option because you do the same thing ultimately. It's just for children. So yeah. Number 4, I would say is Detox. Detox is a very, very niche type of psychiatric specialty. I put this as number 4 because I feel like even if you work Detox, you still need some real psych experience. And I count 1, 2, and 3 as real psych experience. And when I worked in Detox, I had coworkers that were Psych NP students, and they just even admitted that they just really don't feel prepared to work as a Psych NP because they don't have no real psych experience. I mean, dealing with detox patients and like treating detox patients, it's just like patients that are suffering from substance abuse. Yes, they do have some comorbidities like depression and anxiety and things like that, but they're mainly there to get treatment for drug abuse or alcohol abuse. So it's not really like, you don't really get to experience like what it is to take care of a patient that is there for psychiatric conditions, if that makes sense. So number 5, I would say corrections. So if you can't get the first 4, I mean, corrections is not bad, but it's, you know, it's still something. Like, it's better than no psych experience at all. A lot of people say corrections is kind of like med-surg, and I can kind of like picture that it being more like med-surg. But I don't know, I just feel like you wouldn't get really good experience working in corrections, but it's definitely something. Like, you're dealing with a lot of behavioral issues. But I feel like when you become a Psych NP, the job may look very different from a Psych RN or an RN in corrections, so keep that in mind. And someone actually commented on one of my videos asking like about corrections and if corrections is a good job to work in to get psych experience as a Psych NP student. I'll insert like their question here. But I pretty much said, like, if you can find something else in psych, that would be better, but if not, it's better than nothing, if that makes sense. And number 6, I would say outpatient psych offices. Now this one, it's gonna be really hard to find a Psych RN job for outpatient psychiatric offices, just because it's either a Psych NP and a front desk assistant or like a MA or something. Like, usually like they don't really have any specific job tasks or roles for Psych RNs. And I think that they like to save a lot of money just by hiring like a medical assistant or like, you know, people that just handle the paperwork and stuff. But if you can find one, like maybe they could be like outpatient programs, like different like outpatient type programs, I don't know, or like, because I've heard 1 or 2 nurses say they found like a job in an office as a Psych RN, but I don't know, it's just not that common. I mean, some of them could be like Detox, outpatient jobs, and I think I had an interview for one that was an outpatient Detox office. But you know, if you can find one of those, that would be good as well. But I highly recommend some type of inpatient facility first before you do like an outpatient Psych RN job. So I hope this helped. Catch you in the next video. Toodaloo.